You're listening to Mr. Medicare with Harold Solomon on the True Oldies channel 95.9 FM and 106.9 FM. Reach the team with any Medicare-related question. Now, here's Mr. Medicare.
I want to welcome everybody to the Mr. Medicare show. I'm Mr. Medicare, Harold Solomon. The Mr. Medicare show is brought to you by the Senior Health Desk. You can call it 844-607-7283. I am joined by Matthew Munster, one of the principals at the Senior Health Desk. So, Matt, I'm going to start off by saying, so what's been going on this week at Senior Health Desk?
Happy Thursday, everybody. So we're gearing up for AEP. So pretty much just last minute stuff. Agents that have waited till the last minute to get their certifications done, training. All of the new plan options came out. So us agents can now take a look at them and start discussing the new plan options with everybody. So we've been doing a lot of that, a lot of appointment setting. And so give us a call. I mean, the 2022 plans are out. There's a lot of great benefits, extra dental, depending on the area that you live in, Part B buybacks, that puts money on your Social Security check. So we've pretty much just been digging through the different Advantage plans, and it's looking pretty good for 2022. So far, so good.
Very good. Before we get started, I need to let everybody know that as a licensed certified Medicare specialist, there are certain things that we cannot discuss on the show. Medicare has certain guidelines that we must follow. I will do my best to answer your questions. However, if your question falls into an area that we cannot discuss during the radio show, we will call you and schedule a phone appointment so we can answer your questions. Now, this week, we got a lot going on. So what are we going to talk about tonight? What's the topic of tonight's show?
So this week, we'll be discussing ANOC letters, ANOC. It stands for Annual Notice of Change Letters that many of you have received. Now, these are letters that are sent out in September. So at this point, all of you should have received this letter by now. We get a lot of questions about ANOC letters every single year. So this year, we have the Mr. Medicare show. So we're going to try to get in front of it and answer some questions that many of you may have regarding the annual notice of change letters.
All right. When you hear us referring to ANOC letters, ANOC, as Matt said, the annual notice of change letters, they're very, very important because it will highlight any changes in your Medicare benefits that may affect how you can use your Medicare plan in 2022. So, for all of you listening on the radio and watching on our YouTube channel, I brought this. Everyone who has a Medicare plan should have received this. Annual Notice of Changes. Don't worry about the marks. I didn't want to get afoul of CMS rules, so we
didn't get permission by the insurance company.
So we got rid of all the things. But all kidding aside, this is an extremely important document because as you go through it, it says, summary of important costs for 2022. So any changes in your plan, you're going to see 2021, 2022. Very, very important. Every page it's going to tell you, Part D prescription drug coverage, all your different prescriptions, Tier 1, Tier 2, Tier 3. Here's your changes to benefits and costs for next year. Maximum out of pocket, monthly premium. For those of you that may have got this in the mail in September,
And hold it up in front of the camera. How's that, Iggy? Good?
All right. This is an extremely important document because you're going to see, good or bad, what your changes are going to be. So, that being said, Matt, why is this so important for us as agents to use as a tool to help all the people calling in and arranging time?
Well, it's going to tell you all the changes that are happening to either, Medicare Part A, Medicare Part B, or a Medicare Advantage plan. So, if you're used to receiving some kind of benefit from that Advantage plan or from Medicare and that's changed, it's going to be important to know that. So the first question that we get a lot is who will receive the Medicare annual notice of change letter? So you can expect to receive a Medicare annual notice of change letter if you're a Medicare beneficiary. Okay, so it's pretty simple whether you're enrolled in Part A, Part B, Medicare Advantage plan, or prescription drug plan, you're going to receive this letter. Now, depending on how you're enrolled into Medicare, that's going to determine who the letter comes from. If you have a Medicare Advantage plan, your ANOC letter, or annual notice of change letter, will come from your Advantage plan carrier. Now, if you're on original Medicare A and B, like let's say you have a supplement like a Plan G or a Plan F or a Plan N, the ANOC letter is going to come from Medicare itself. So that's the Center for Medicare and Medicaid Services.
Now, as I said before, if you've received this or you think you saw it and you went like this and you just put it down somewhere, I would seriously urge you to find this and go through it and compare what your current year benefits are for 2021 and what your benefits are for 2022.
And guys, this is really, really important information. I can't tell you how many people I speak to that are unaware of how their health benefits work. And the thing is that's how most people are, because you don't know how your plan works until you actually use it. And at that point, if something's wrong, it's too late. So this is all really good and important information. If you're watching on YouTube, please hit the like button, share this to Facebook or whatever social media platform that you're on. If you're listening on iHeartRadio or you're down here in Florida listening locally, thank you for listening. Tell your friends to listen. We're live every Thursday at 7 p.m.
Now, one of the rules of Medicare is, as Matt said, this letter has to be sent annually in September because our annual enrollment period starts October 15th, runs through December 7th. So everyone, whether you have Part A, Part B, C, D, you get this information. Now, especially for Part C, for people with Advantage plans, because everybody's going through that, well, I'd like to get more dental. Maybe I need trips to the doctor. So if you look in your ANOC letter, you'll see what your benefits were with those criteria for this year and what there may be next year. So Medicare, the guidelines of Medicare require that the letter be sent annually by September. So everyone, please go look for your letter. If you have any questions about it, because it can be very confusing, that's why we're here. The Senior Health Desk is here to help you understand these things. Just call the Senior Health Desk, 844-607-7283. And then go to the website. What's the website address?
seniorhealthdesk.com. We're also uploading these weekly videos. We do, if you're listening, we also do videos, so we upload those videos to the website as well. You can find it on the Mr. Medicare Show tab, top right of the page.
Also, there's a calendar available for people to schedule an appointment, correct?
Yeah, actually, we're only taking appointments by phone at this point because all of the calendar dates have been filled up. So just give us a call. Again, the number is 844-607-SAVE or 844-607-7283. One of the things that we get asked a lot is what changes to Medicare plans can you anticipate? So this letter is going to include all the changes to your Medicare plan. It's going to include cost changes and, if applicable, benefit and service area changes. So that's the network of doctors and hospitals that are in network for your plan. Beneficiaries enrolled in a Medicare Advantage plan will receive a letter including changes in costs, benefits, and any changes to the service area as well. Now, private insurers offering Part D plans or Advantage plans that include your prescription drug coverage. This is really important. They're also required to send their beneficiaries an ANOC letter, annual notice of change letter, regarding the medications. The changes listed are going to include costs, service area changes, and formulary changes. Now, service area changes, that's going to be like your preferred pharmacy, what pharmacy you go to fill your medications. So that's really, really important because if you're on an expensive Tier 3 or Tier 4 drug, and now that I mention it, we should probably do an episode on tiers.
Absolutely.
I think that would be really good. So if you're taking an expensive Tier 3 or Tier 4 drug and you've managed to find a Part D prescription drug plan or Medicare Advantage plan that includes really good prescription drug coverage and covers that's what's typically expensive, tier 3, tier 4 drug, you're going to want to look at your annual notice of change letter, because the coverage for that prescription drug may have changed. And if it's changed, it's something that you're going to want to know, because when you go to fill that prescription come January, the last thing you want is to find out that your medication has quadrupled in price.
For those of you who just might be joining us, you're listening to the Mr. Medicare Show. The Mr. Medicare Show is sponsored by the Senior Health Desk. As we're saying, the annual enrollment period for Medicare is coming up. Any questions, call the Senior Health Desk at 844-607-7283. So now that you've got this letter, what you have to do is you've got to take a piece of paper and a pen or a pencil, and you have to say, okay, I have this benefit for 2021, but I'm trying to find some benefits for 2022. In this little brochure that you received, they very nicely in the back left notes, lines, notes. Use it, mark it down, because when you call and we talk to you, just say, 1 second, I went through my coverage this year and I made some notes, and tell us. We're looking for dental, we're looking for trips to the doctor, whatever it is that you may need. The more information you provide to us, the better job we can do to find you a plan that will meet your needs. So it's extremely important that you call us, give us a chance to talk to you and help you with all these different changes.
Yep. So your ANOC letter came with something that's called evidence of coverage. What is that? So the evidence of coverage is usually mailed along with your ANOC letter or annual notice of change letter in the fall. The evidence of coverage is a list of Part D and Medicare Advantage costs and benefits. Now, these costs and benefits will all take effect on January 1st. So if you receive that evidence of coverage with your annual of change notice, just know that those plan benefits start January 1st. So Medicare Advantage plans, their benefits remain the same from January 1st to December 31st, and then during the annual election period is when all the changes come out. That's why we have the ANOC letters. For many that aren't super familiar with insurance, the evidence of coverage covers a lot of information, and it may be confusing. So if you see something on your evidence of coverage that you don't like or doesn't quite make sense or you have questions about, feel free to give us a call at Senior Health Desk. The number is 844-607-SAVE. That's 844-607-7283.
One of the reasons we brought up for this show the ANOC letters is I'm always surprised when I say to people, so what kind of coverage do you have now? And what's their answer? They go,
Yeah, I don't know. Or I have a supplement and it turns out to be an Advantage plan. There's a lot of confusion, and that's why we're here.
And the reason we're going over this ANOC letter is you're being provided through either the federal government, if you're just on original Medicare A and B, or if you have a Part D plan, it's going to give you your prescriptions. Very important, as Matt said. If you have a prescription that said for 2021 it's $0 copay, but you see in 2022 it might be $10, it might be $5, it might be $15, or you may get lucky, hopefully, and it goes the other way. You were paying $15 and now it's only $5, but
maybe they're removing dental from the plan.
That's correct. I was just going to say, as Matt just said, it will tell you, this ANOC letter, if a certain benefit that was available in 2021 that you're just assuming is going to be available next year, it may not be.
Sure, absolutely.
So now what we're trying to do is we're going to have to explain to you what to do when you call us. When you give us a call, we're going to have someone who's going to answer the phone, and we're going to go through this process to find out what your needs are, what your prescriptions are, and then we're going to go beyond that just for the cost, because we also have to find out about someone's doctors.
Yeah.
See if their doctors are in. Now, that isn't in the ANOC letter.
No, that's not in the ANOC letter. You'd have to... Yeah, give us a call. Give us a call. We can search the network for you. If you are concerned that your doctor is not in network, give us a call. We can look it up, and if your doctor's still in network, we'll let you know. And if you're looking for other plan options, we can absolutely help you with that as well. Another question I wanted to go over is, where will the plan providers mail your annual notice of change letter, or where will Center for Medicare and Medicaid Services mail your ANOC letter? So without your current address on file, and I'm speaking to people that have not received the annual notice of change letters and feel that they should have, without your current address on file, you're not going to receive the ANOC letter that Medicare sends out each fall. So you'll also want to be sure your address is up to date with any private insurance companies with whom you do business, as well as the government. Otherwise, you won't receive the ANOC letter that's mailed to you each autumn. It's just really important. I wanted to add that if you guys have not received that ANOC letter.
Now, what you have to understand is nobody knows if you moved over some point in this last year. You have to get in touch with your provider, whether it's the federal government, if you just have original Medicare A and B. If you have Part C, which is a Medicare Advantage plan, you have to let your plan provider know that you've moved so you get all this information, because if they don't have your current address, they can't get it to you. So after you're receiving your annual notice of change letter, go through the brochure, go through the ANOC letter, make all your notes, and then give us a call, because when you do a benefit comparison, it's very essential, because you have to include a list of services that you most frequently use. Some people have durable medical equipment, or they need a yearly EKG.
Or transportation to and from doctor visits.
A cost comparison is very important to ensure you can still comfortably afford your policy, because if you see it's going to change adversely and it may cost more, that's something you have to know going into the annual enrollment period, because if you don't know it and you don't tell us, we don't know what to look for.
Yeah, I mean, last year you worked with your trusted licensed insurance agent, and together you reviewed the options available to you and compared these options with your anticipated medical needs in mind. Now, after a cost comparison and a thorough review of your options, you decided on a Medicare plan that would best meet your needs. When those plans change, you must be notified, and that's where the annual notice of change letters come in.
Also, we usually get calls this time of year. Someone calls in a panic. I went to my doctor, or I had a certain procedure scheduled, and they said, oh, we don't take that plan anymore.
Right. Because again, then that'll be included in the annual notice of change letters if there have been network changes. Okay, changes to the service area.
Sometimes a hospital says there are negotiations with Medicare for 2022, and they don't come to an agreement on what they feel is, a good deal for them, and they decide to opt out.
Yeah, and if you guys are looking at this annual notice of change letter, almost every line item on there for each service is going to differ depending on the insurance carrier and the specific plan that they're offering. So as you're looking through that, keep in mind that there may be better options that give you lower copays on each one of those line items, or for services that you're going to be using next year. So if you're looking at that and you're like, you know what, it would be nice to, save some money, God forbid I have to stay in the hospital as an inpatient, give us a call. We can help you with that. If the plan removed its dental coverage, give us a call. We can find you a plan that accepts your doctors and puts you back with the dental coverage that you want. If you don't really use your insurance, but you're kind of upset that the Medicare's taking out $148.50 from your Social Security check every month, there are plans that give you money back on your Social Security check to kind of lessen that blow a little bit on your Social Security check. So there's a lot of things with these Advantage plans that many of you may not be aware of. Give us a call. We'll help walk you through all of that. Again, it's 844-607-7283, 844-607-SAVE.
For those of you that might be tuning in, you're listening to the Mr. Medicare radio show. Tonight, along with Matt from the Senior Health Desk, we're going over the ANOC letter, which anyone who's on Medicare should have received by the end of September. We're only about a week into October, but it's very important that you look at that, because changes are always happening. If you want to keep your doctors for next year, which will be 2022, you've got to give us a call. Let us know who your doctors are. And please, I always remind people, sometimes when you get someone on the phone and I understand something could be happening in their life that day, they're not really focused, and they say, here's my primary care physician, and I have a problem with my foot, so I see a foot doctor. Mm-hmm. But then they forget they go twice a year for an EKG and they have a cardiologist. Sometimes people have back pain or leg pain and they go see someone else.
Sure.
And if we don't know that, we don't know to look to see if your doctor's going to be in the plan that you may have for next year.
That's right. And, I come across some people that think that, changing insurance, it's this whole big ordeal. First and foremost, we make it really easy. We have a tried and true process that we use to make sure that we're meeting all of your needs and putting you in the best plan for you. But secondly, it's if you have an Advantage plan now and you're considering changing to another Advantage plan and you're sitting there thinking to yourself, I got to look for a new plan and start all over. And then if I find that plan, I got to call the old company and cancel it out and do this whole rigmarole. It's Medicare makes it as simple as possible. And then we pick up at Senior Health Desk the harder aspects of it. So if you give us a call and we find a plan that fits your needs, that's going to put you in a better position for next year than staying on your current plan, we enroll you into that plan. We take care of the hard part for you. Once January 1st kicks in, your new plan automatically starts and your old plan gets kicked to the curb. So that happens automatically. So there's no calling insurance companies, fighting with people. The funniest, and I'll leave the cable company out, is when I visited my parents up in New York, they had stood us up on 4 appointments because it was either the cable or the internet wasn't working. I forget, it was a long time ago. And after 5 appointments, I was like, okay, this is ridiculous. Pop, we're going to change cable companies because this is just ridiculous, right? So we call in to cancel, and you know where they sent us? The customer retention department, so they can keep us as a client. And then basically what it is you get on the phone with an aggressive salesman that's just trying to, say whatever he needs to say.
But I'm sure the first thing they did was apologize for your inconvenience in missing those 4 or 5 appointments.
Yeah, repeatedly and with a lot of passion too. That was that was sarcastic. But yeah, So basically what I'm saying is it's not that easy. It's not that hard. I'm sorry. It's not that difficult to change plans, and you don't have to worry. If you're coming from an Advantage plan, you don't have to worry about canceling out the old Advantage plan if you're going to a new one.
What I want to do, and for those of you just joining us, if you're listening in, you're listening to the Mr. Medicare show sponsored by the Senior Health Desk. We're quickly approaching the annual enrollment period. It runs from October 15th to December 7th. You have a one-time per year opportunity to add, change, or drop your Medicare Advantage plan, your prescription drug plan. If you currently have a plan, whether it's an Advantage plan with prescription drug benefits or just a standalone prescription drug plan, because you might have original Medicare and a Medicare supplemental policy, this is the time that you have to enroll. If you miss that window and you don't do anything, whether you like your Advantage plan, let's say you have an Advantage plan or not, what's going to happen is you're going to be automatically renewed.
That's right.
And you're done. You've missed your window. Same thing for your prescription drug plan. Now, I have a lot of people, I'm sure you do have clients, and Rich does, that have supplements and a Part D prescription drug plan. And it was fine when they started last year, the beginning of the year, but somewhere along the way, March, April, June, July, September, whatever, maybe something happened, and they were prescribed another medication.
Yeah, sure.
And that wasn't originally part of their plan. Then all of a sudden we get that call.
Yeah, and that's, you're 100% right. Listen, if you have been through the unfortunate circumstance of being diagnosed with, a new ailment or, like Mr. Medicare said, prescribed a new medication or are seeing a new doctor, right? Or now all of a sudden you've never had to really see specialists, but now you are seeing specialists and it's costing you a lot of money. Give us a call because we can look to lower the cost of your specialist copay. You know,
the reason we're doing this particular radio show at this time, because the annual enrollment period is going to start just about 8 days from the airing of this show. Time is running out. You're running out of time. So we're encouraging you to find your ANOC letter, go through it, make notes. This is now the time to give us a call because we've been waiting basically the last few months for this time of the year. As you said before, you and Rich are bringing all the agents up to speed. You're having all these meetings about the changes in Medicare and what's different for 2022 from 2021. I've been getting emails, as I'm sure like you and the other agents in the office, about this company's making this different, this company's doing that different, but you have what? Dozens of companies if you have a Medicare Advantage plan to choose from. And one thing I want to caution people, please understand, this is not a one-size-fits-all thing. Let's say you live on the East Coast, on the Southeast, and you have a family member or a friend who's on the West Coast or maybe the Northwest. Don't assume if they say, oh, I have a plan and it's the same company, that it's the same plan, because these things change drastically from your location, not even state to state, East Coast, West Coast. It could be county to county within a state.
Yeah, zip code's a zip code.
That's correct. So what we're going to try and ask everybody to do is, Matt said, unfortunately, all the spots have been filled for the people that have reserved time coming to the website, is give us a call, 844-607-7283, and let us help you, because we help people all over the country. From the East Coast to the West Coast, South, North, we're licensed in just about every state in the country. And with so many changes, we're the trained professionals, licensed, certified Medicare specialists that are here waiting to help you.
And let me jump in because I want to make sure there's no confusion on this. So when I say that all the spots have been filled on the calendar, it doesn't mean that we are booked up for the entire 7-week period. We reserve some spots for people that are reserving ahead of time, and then we leave a bunch of time open for people to call in. And on that note, I just wanted to add that the annual election period runs from October 15th to December 7th every year. It's a busy time of year. There's literally millions and millions of applications for plans being processed. It generally takes about 3 weeks for your paperwork to arrive in the mail. So do not wait until the last moments. Do not wait until November or December. Get this done ahead of time, because we want to get all the paperwork out to you. Take a look at the plan, and for whatever reason, before December 7th, you get your documents, you're like, you know what, this isn't right. I want to look at a different company or a different plan or a different option. We still have time to do that. So we want to make sure that we're taking care of you. Do yourself a favor and don't wait until the last minute. Don't procrastinate. October 15th is day one of the annual election period. We're sitting here waiting for your call, and we'll take care of you. So do not wait.
Please tell all of your family and friends to join us every Thursday at 7 p.m. Eastern Standard Time. Our goal is to help as many people as possible. If you have a question but you don't want to call us here, you can give us a call at 844-607-7283. If we're on the phone, please leave a detailed message. We've had many people that have listened to the show. They've called or emailed with questions. They've gone to the website or they've watched the YouTube page, and they've already given a call, as Matt said, and all those spots already from that calendar have been pretty much taken. However, there is time slots available because, as Matt said, he always leaves time, because sometimes, and I'm not here making a political statement of any kind, I don't want to get in trouble, but a lot of my clients have been telling me the mail service has not been what it used to be. You could mail something out on the 1st, and 3-4 days later, you received it. Now with the mail, they're all saying, when did you mail that? Oh, you mailed it on the 1st. It's now the 12th.
Yeah.
I don't have it. So with all these things going on, and we're still dealing with COVID, please don't wait till the last minute. Pick up the phone. Give us a call, 844-607-SAVE. That's 7283. Please listen next Thursday. We're going to be getting into, in more detail, the annual enrollment period, because that show is going to be just one day before the annual enrollment period actually begins. That show is going to be on the 14th, and the annual election period is going to start the next day. But we do want to take a moment and thank everyone for listening to the show, whether you're listening on iHeartRadio or watching on YouTube. We do this for the Medicare community. It's been great working with everyone. We couldn't ask for a better audience. If you haven't scheduled an appointment yet for the upcoming annual enrollment period, please give us a call at the Senior Health Desk, 844-607-7283. Find your ANOC letter, review it. We'll be back next Thursday, and we'll jump right in for what's going to be happening with the annual enrollment period. We'll see you next Thursday.
Thanks so much.